Hello. That's not it. This is probably how long it's going to take too if it doesn't show me what I want. Ready yet? Nope. That's not it. That's weird. That works, I guess. Okay, so remember to click on the other open window. So here we go, hydro or aquatherapy, healing in the water. A lift, just something to consider. Maybe there are some things you can do in your facility in the water if you have a pool for your patients. Anything you feel is out of your jurisdiction, you can refer out. Don't forget water healing options when you're doing your diagnosis or doing your referrals. You can use a hydrophysical therapist. Partnering with an aquatic center or bigger pool can provide some extra things. A lift for something more serious than burning hamstrings, such as maybe injuries that makes it someone immobile or temporarily harder for them to walk. So things like the lift in the facility can make a great transition, can make the facility a great place to do the therapy, and other things are great about it besides the lift, like the transitioning to land for aftercare. I am sure they will be back in the sport that they're in when they're better, but just in case they want to swim when they're healed, water has healing powers, maybe they can cross-train. This is especially important for things other than what we will be diagnosing medically. So many people can benefit. She is a physical therapist. She is talking about some of her findings in this podcast. Once again, partnering with a bigger pool or referring patient out to appropriate facilities can bring a benefits. Some people are attracted to the hot tub or sauna or therapeutic swimming, which is separate from the aquatic therapy, so they can transition to the other therapy afterward. So that's what she was talking about. The benefits of water. The healing components or powers, if you will, so healing benefits. The side study to support the benefits. Abused women's psychological and physical benefits that they obtained in this program. Water was not a typical area of therapy, but it helps them to find a healthy and positive way for themselves to physically reconnect to another human being. So spectrum is huge of who can be helped by the water. So orthopedic conditions or post-hip surgery, post-operation, children with neurological orders, someone who has had a stroke, wheelchair, people that are in the wheelchair, just simple balance, everyone's balance, all the way to psychological things. The joints have less shear forces on them in the water. The water makes you buoyant, so the buoyancy, you feel lighter, less pain, you feel happier, confident. You can strengthen muscles and strengthen joints and things in the water, the lighter impact, and then you can transition to land. people who benefit from the water, people with TBI, osteoarthritis, rheumatoid arthritis, pain with increased impact, pain that is increased by impact, anyone. So if your injury has pain, especially when you're on the land training, there's increased impact up there. You want to get down in the water. Neurological patients benefit from water. And I think injuries of all sorts. I used it for a strained ankle. The doctor wouldn't have told me to go there, but I strained at UNLV dance, and we just happened to have a person from the aquatic therapy department at UNLV come and talk to us on that Friday. So I thought, well, whatever my current injury is, I will just give it a try. And it did help so much. I had a one-on-one with George, and he moved my ankle around, and we did all sorts of things. Being a Pilates certificate student, you think about all the tiny muscles supporting the larger muscles, and also alternative exercises that do not create such an impact on your joints. I believe the water has similar benefits in this department. The water will strengthen. So for more information, here's the podcast itself, Aquatic Therapy Optimizing Effects of Buoyancy podcast, Aspirus Healthcare, and my creative videos just to add my practice presentation, my practice podcasting, talking about the presentation. This has been Heather Young, and I have an audio recording of me presenting just for fun available upon request. So in my first attempt to use my voice to elaborate on the slides, or just saying, I guess elaboration is my podcast and my practice presentation. But what I just did now, I did and I recorded, including the slides more, actually reading the slides. So it's kind of like backwards. Okay, thank you.